work at CHR in a program called Healthcare Liaison, which program's been going on for 2 years now. And our mission is to help our CHR clients get the best medical care possible. This is Carlos Boscana, and I'm very happy to introduce him, and he's going to tell you in a minute a little bit about his story of how he went from being homeless, living in a shelter, having problems with hearing voices because he had undiagnosed schizophrenia, and drinking alcohol to cope with all that stress, to today being healthy and happy. So we know from statistics that people with mental illness die 20 to 25 years younger than the general population. So CHR took a look at what those medical illnesses were that were killing people, and that's who we targeted. So we look at people that have problems with diabetes, with lung disease, with heart disease, maybe overweight, high blood pressure, and we've been working with those folks. I have a caseload of about 20 clients, and it would be great if we could expand this program so that every client at CHR could get these services. So as a child, you had a head injury and you had some learning problems.
Yeah.
And then on top of that, you had the mental illness problem and the alcohol. So that's an awful lot to deal with.
Yeah.
That's one of the reasons I'm so impressed with your story, is because you've really turned your life around. So I met Carlos a little over a year ago when his psychiatrist from CHR, Dr. Connors, was concerned about his medical health. Right? She used to talk with you not just about taking medications for hearing voices, but she talked to you about nutrition and exercise.
Yeah.
She was just concerned about your overall well-being, and she asked me to meet you. And when I first met you, you had a doctor that you had been going to, but interesting, the first visit I went with you to the doctor, you had high blood pressure and high cholesterol, but you weren't on any medication for that, which puzzles me. I don't know why that was, but I'm really glad that that day we were able to get you on both those medicines, right?
Yeah, because thanks to you, you know, I got the medication that I needed.
Right, and now, you know, it's all about learning about health too. So for instance, I think about a month after I met you, you were on the medication for blood pressure, but you didn't even know that you were supposed to take that for a long time. So when it ran out, you didn't know how to refill a prescription.
Exactly, yeah. I thought I was finished with the prescription, and I didn't know that I had to refill it until Elaine told me, you know, and I got the medication, you know, again, she made an appointment for me, and I started getting the medication over again because I'm not supposed to stop taking it.
What do you do if you run out of medication now?
I call the pharmacy and have another prescription made.
Well, working with Carlos, he lost 25 pounds, which I think is phenomenal, by changing the way he eats and exercising. The other thing we worked on is Carlos was complaining of not being able to see well, even though he had just seen an eye doctor before I met him, and he had eyeglasses. He kept saying, I can't see. It's like there's a blanket over my eye.
Yes, I remember that.
So talk about that. What happened? We went back to see a specialist about that.
Yeah, went to see a specialist, Dr. Jing, and he analyzed me, and he said that I'm right about what I was saying, that I had a cataract. And he said that I needed an operation. I said, okay, I knew there was something wrong. Even though the eye doctors with the glasses kept giving me prescription for them, you know, and that wasn't the problem. The problem was the cataract. So I was kind of blind in that eye.
A very large cataract, which really caused pretty much legal blindness.
Wow.
And it actually turned out that you have a rare eye disease, which caused the cataract. So now you need to see Dr. Zhang, the specialist, the eye surgeon, twice a year. But how's your vision today after that surgery, which I took you for?
Oh, it's perfect. I can see well. I can see colors clear. I can see people from far away and close. But I still got to use glasses, you know, because my eyes are not 20/20, but they close to that.
That's fantastic. That's
good to
hear.
Do you think without this program, would you have been able to get the eye surgery?
No, I would not have been able to.
Do you remember we got up at, I think it was 5 o'clock in the morning to drive to, I think it was Newington.
Yeah.
And medical cabs don't drive at that time. So I don't know really how Carlos would have had that surgery without this program. But he had to do eye drops, you know, for like several weeks before the surgery.
Yeah, for about a month, I think it was.
Yeah.
For about a month, I had to take eye drops, different types of eye drops, before I had the operation. And after the operation, I had to take eye drops, you know, and for about a couple of weeks, and then that was it.
Yeah, it was a pretty complicated schedule, actually.
Yeah.
2 different kinds of eye drops at different times,
Yep.
so needed a lot of attention. Another thing is that you were telling me you really couldn't hear well.
Yeah.
So you went for a hearing test, and how did that work out?
Oh, I found out that I have both my ears were a little bad, you know. My left ear was the worst, so I have an earphone in my ear, you know. The doctor gave me a prescription for it, and I got one, and I could hear a little bit better in my right ear, but you know it's a little deaf too, but you know not as bad as my left ear. So the doctor only gave me one earphone for the left ear.
Hearing aid.
Hearing
And again,
aid,
that
yeah.
was quite a long process that we worked on, because he had to have a hearing test, which was in Hartford at St. Francis Hospital. And then he had to see an ear, nose, and throat specialist, a doctor over in Vernon, and then we had to go to the Hearing Wellness Center. So
Oh, wow.
it was, you know, probably 6 appointments to get this hearing aid.
Yeah,
But now you hear pretty well with that.
yeah.
That's interesting.
There was no other way of going around it. I had to do all those appointments before I could get the hearing aid.
I didn't know that.
Yeah.
You'd think it would be all under one roof, but it's
Right.
not.
So you got to take all different types of tests from different doctors. They don't all do the same thing. You know, they have different procedures and different
Right.
doctor's degrees. You know.
You got to get Husky approval to pay for all of these different
Yeah.
things. So now, let's talk about what happened to you last summer, which was really scary. I was on vacation when this happened, but I remember talking with you on the phone. You got really sick. Up until last summer, Carlos had not been diagnosed with diabetes, but tell us what happened.
Well, the week before I got sick, I was seeing the doctor. They gave me the okay. I was fine after a physical, and then about 2 weeks after, I've been drinking a lot of sugar, soda. I've been drinking 2 gallons of soda a day. I've been feeling thirsty. I've been peeing a lot. I didn't know what was going on. I just thought I was just thirsty, and I thought it was just the weather. But it was my type 2 diabetes kicking in. And so finally I had a stroke.
Oh gosh.
I fell back, and when I woke up in the hospital. I didn't know where I was. Hopefully a nurse was at the house, and he called an ambulance. And I was in the hospital for 1 week. My sugar level was 1,000.
Wow.
And normal is?
Normal was 100, right?
Right.
Normal was 100. And I was in a coma. I was in the hospital for a week, and after that, I had to go to a daycare center to learn how to take injections and test my blood. So I did that for 1 month.
And the hospital was just going to send Carlos home.
Yeah, they
You know,
was just
here
going to
you
send me
are,
home,
take
and I
your
still didn't know
insulin.
what to do, you know?
Yeah.
So I did intervene there and said, I think we need a nursing home for about a month, and just kind of encouraged them to do that referral, because I was concerned about Carlos being able to manage his diabetes right off the bat.
Yeah, thanks to Elaine, I learned how to do my own blood tests and do my needle shots, you know, 'cause I was afraid of needles. I never used needles before in my life. But now I got used to it.
So how's your diabetes today?
Oh, they normal. My sugar
That's
levels are
fantastic.
normal.
Yeah. But the doctor said, when you were in ICU, the doctor told me if they hadn't found you on the floor, you wouldn't be here today.
Yeah.
You were gonna die.
Yeah.
That's how bad it was.
Absolutely.
But basically, you went from, you know, drinking, we went to a liver doctor, right, to check because your liver was diseased because of the years of drinking.
Yeah.
And so you watch that very closely now. You've given up drinking. You're working on quitting smoking. You lost 25 pounds.
Fantastic.
You're managing your diabetes. Your vision's good. Your hearing's good. And all of this is the hard work you've done.
Yup, I had a fatty liver from drinking and eating fatty foods. I was eating a lot of junk foods until I got on a diet and started losing weight. And that was part of the diabetes, you know, my overweight.
The other thing is Carlos is now independent in getting to his own doctor's appointments. So talk about that.
Yeah, now I take the bus. I got the address, where to go, the phone number that Elaine helped me pick, write down in my date book. Cause I didn't have them, and Elaine helped me a lot with this information, and I could take the bus to my appointments now if I need to.
And you've learned how to talk to your doctors,
Yeah,
right?
learn how to talk to my doctors. I've been listening to Elaine. I've been listening to Elaine, and she's been teaching me, what to do, because I didn't know what to do. I never been sick before. I never had to talk to a doctor,
How's it feel to be healthy?
It feels good. It feels good to be alive. I was almost a dead man. I was having so many problems medically, I just didn't know what to do.
That's fantastic. I mean, it's
CHR, saved my life. I'm happy that I found out about them. Otherwise, from Chris Rose, otherwise I'll be a dead man. I'll still be drinking, I'll still be sick, and probably be in the ditch somewhere dead. It wasn't for Chris Rose, and all the other doctors here.
It's been really a pleasure working with you.
It's been a pleasure too. You taught me a lot.
And you taught me a lot. When I started this program, I didn't have the expectation that my clients were going to be able to lose 25 pounds, learn to take care of their diabetes, quit smoking. And now when this happened with you, now I expect this from all my clients. So you taught me a lot, so I'm very hopeful.
Yeah, we need government funding and approval, because CHR needs to grow, because we have many towns around Manchester, and there are thousands of people that need help. They can't get it because they ain't enough staff, and we really need this. I know for experience, how important it is to have CHR help, because you can't find it anywhere else.